Hello, my name is Seth Harrison, and I will be presenting the sexually transmitted infection herpes simplex type 1, oral, or also known as HSV1, herpes simplex virus 1. What exactly is herpes simplex type 1? Herpes type 1 is most commonly found around the mouth and lips and leaves sores sometimes known as fever blisters or cold sores. What exactly causes HSV1? For the infection to occur, the following must apply. The virus passes through bodily fluids such as saliva, semen, or fluid from the genital tract. Virus has direct access to the uninfected person through their skin or mucous membranes such as the mouth. How is HSV1 transmitted? For people to become infected with herpes, the virus must get into the body through tiny injuries in the skin or through a mucous membrane. The virus is carried through bodily fluids or in fluid from the herpes sore. Risk for infection is at its highest with direct contact or blisters or sores during an outbreak. Other ways it's transmitted: infected people can transmit the virus simply by personal contact, such as kissing or by sharing toothbrushes or eating utensils or other objects. Once herpes is in the body, the virus enters the body and begins to replicate. The virus is then transported within nerve cells to their roots where it remains inactive for a period of time. During an inactive period, the virus cannot be transmitted. The virus may enter a stage where it multiplies without symptoms called asymptomatic shedding. During shedding, the virus can infect other people through exchange of bodily fluids. What are some symptoms of HSV1? HSV1 usually affects the lips and in some cases attacks the mucous membranes in the mouth. Herpes can also occur on the cheeks or in the nose, but facial herpes is very uncommon. If the initial infection causes symptoms, they could possibly be painful, especially in small children. This infection consists of blisters forming on the lips, typically within 1 to 3 weeks after contact with virus. Blisters eventually rupture as painful open sores develop a yellowish membrane before healing and disappears within 30 to 14 days. Increased saliva and bad breath may be present. The reoccurrence in the virus: most cases of herpes do reoccur. Typically, infections reoccur a couple times a year. Reoccurrences are usually much milder than the primary infections. How do you prevent the transmission of HSV1? First, people who are infected should take steps to avoid transmitting the infection to others. You could also apply sunblock or lip balm containing zinc oxide to lips before you go outside. A moisturizing balm to prevent lips from becoming too dry. Avoid direct contact with the herpes sore. Wash items such as towels and linens in boiling hot water after use. Do not share utensils, straws, glasses, or other items if they contain herpes. Do not have oral sex if you have HSV1, especially if you have blisters. You can spread the virus to genitals. Treatment of HSV1: you can treat oral herpes by either taking antiviral pills or topical treatments. Antiviral pills consist of aclavir, valaclavir, and famicovir. Topical treatments such as aclavir cream, Abreva, and other counter ointments may provide relief. Ointments or creams can help shorten healing time and duration of the symptoms. Statistics: globally, 1 out of the 5 of the total adolescent and adult population is infected with genital herpes. Infection is more common in women, approximately 1 out of 4 of every woman, and in men it is almost 1 out of 5. Male to female transmission is more efficient than female to male transmission. About 80% of American adults have oral herpes. When searching for local and statewide statistics, I could not find stats for Louisiana or Lafayette. The search kept bringing up only doctors that treat herpes in the area and global statistics only. Some additional factual information: herpes, there is no known cure for the herpes simplex virus, and once a person has the virus, it remains in the body forever. The virus will lie inactive in nerve cells until it's triggered again. HSV1 can also cause genital herpes. Most people in the United States are infected with the virus by age 20. And that concludes my presentation.